Welcome to HINS TV. I'm Sarah McGeet. I'm the Associate Editor at HINS EMEA. Today, I'm delighted to have with us Christine Sorensen, who is the Global Health Literacy Academy founder and director in Denmark. She serves universities, international organizations, companies, and public authorities, which include the World Health Organization, Council of Europe, and McKinsey. So thank you very much for joining us today, Christine.
Thank you very much.
So can we start off by having you explain to our viewers what empowering patients in the digital age looks like?
For me, empowering patients is about the ability to navigate the whole health systems. So being at home in everyday life, managing health, if you're ill, getting organized and contacting a doctor, having certain treatments, being able to apply treatments and follow up and have a good recovery if that's the case, and all with really good digital means to support the process.
Thank you, Christine. So obviously, self-management in health is a key component to creating a sustainable healthcare system. We wanted to ask you, what is currently being done to improve digital health literacy?
Yeah, so digital health literacy is one of my key focus areas, and also health literacy in general. We do see a paradigm shift happening now where we are moving from specialized care in healthcare settings such as hospitals and expert treatments, going towards doing more at home with the support of your family and primary care. And for this, we need the digital support. However, then also the digital health literacy to actually conduct the self-care, but also importantly, the support from the systems to do so.
And what are the three biggest challenges you think should be prioritized over the next few years?
I see a big challenge to get the proper political will and management buy-in to change the system so that it supports patients to actually recover in a timely and appropriate manner, to getting the services that they need in a timely fashion. We have a system that is very much based on economic models rather than mental and social care. And I think we need to see that shift. So that's one of the challenges. And then also more integrated care, where we build on relations and better shift from being at home and then coming into special care and getting on with treatments. Often there are so many breaks and lack of communications and hurdles and barriers, and I would hope we can find ways to lower those barriers for the patients. And then indeed, regarding health as an asset rather than a burden, which I think is often the case now from the system point of view, I do think there is a big untapped potential to be used, and that we as people, patients, users, consumers can do much more with the right support, and therefore also shifting this paradigm.
Thank you. Some great points there, Christine. And are there any countries you feel that are leading the way in using digital to empower patients that we can really look at as a great example?
Mm-hmm. We know that Estonia, for example, in the European region has been a front runner, and we know the Scandinavian countries are quite far based on registrations and digital services. I've also seen the transformation that the UK is going through, for example, Scotland, that is far ahead. And I do think we need to make services much more accessible, and that we need to enhance the user engagement in this design. Top-down approaches are not valuable and viable anymore. People need to have the circumstances and the conditions in place where they can make shared decisions, and that is what we should aim for.
Absolutely. Accessibility is a very, very important thing we should all strive for. And finally, I wanted to ask, is there anything our viewers can look forward to learning about or hearing about at the European Health Conference?
Yeah, I look forward to be part of the panel in the conference and speaking about how we can improve health literacy and digital health literacy, not only for people and individual levels, but also for the system levels. And I do hope that we can have, challenge the status quo and find solutions together on how we can transform and make the necessary transitions towards a better health.
Fantastic. Thank you so much for joining us today, Christine. It's been an absolute pleasure. And we look forward to hearing more about empowering patients using digital at your session. Thank you very much.